Okay, let's go ahead and get started. I know we have a few more people that'll be attending, but Shona is a wealth of knowledge, so I want to give her as much time as she can. Shona Heim has been with the region for how many years, Shona?
Well, now it would be 37.
37 years she's been with the region. She's our clinical supervisor, and I've learned so much from her. And I've seen her do this, the effects on the trauma on development. She has done this training for us a couple different times. And so it was something that I really felt that a lot of direct service workers needed to have this training. And if you have specific questions about specific families or anything, please ask her. And also the ones on distance learning, go ahead and ask the questions as they come up. Shona also, well, I'll let her tell a little bit more of her background and everything like that. I feel I could, but I think I'll let her go ahead and do that. So again, if you have questions, please stop her, ask the questions. She can put this into the perspective of the families that you're working with as she's going through it. So thank you very much.
All right. Thank you, Bonnie.
You're welcome.
Yes, I'm Shona Heim. I retired from Region 2, but I still consult with them. So that's why I had to stop and think. But for about 35 years, I really did go up and down the highway. I didn't go very far, but about 50 miles from home because I served like the Benkelman, Juanita, Grant, Imperial, Ogallala, and McCook down in that area. So I was on the road every day as a therapist. And so in turn, some of this is just based on my experience.
Whiteboard, not you.
And I'm going to
Ogallala, can you mute?
And then I'm going to mute this. If you have a question, you're going to have to come up and mute it. Okay. I will find that external mic in the meantime. Okay.
Yeah. Oh, do you guys have handouts and did you sign in?
No, we can.
How's that? As they're doing that.
You guys hear us?
Excuse me.
What was that, Mary?
Yes? Oh, okay. A little bit, all this information is, if you go on and look at development, none of this is original on my part. This is just a lot of different developmental people who have written. I like some of the Klein Fay stuff, some of the Virginia Satir. Because I've been around a lot of years, you kind of pick up a little bit of this and that. And so I put it in the format for me as a therapist through the years to get an idea of the whole picture of the family I'm working with or the individual I'm working with. And I think a lot of times that what we do is we got to support a family, we need to do parenting, we need to do this, we need to do this, we need to do this. Sometimes we don't always know the why of why we need to do this at this time and how it really does impact the family, What is it we want it to do in the long term? We don't have that,
Okay.
I want to see that big global picture.
Select a speaker. What would I do?
What I'm doing
It
right
says
now.
speakers, headphones. That's what it's on.
I'll take care of this right now with this family, or I'm just supposed to.
Intel display audio HDMI or same as system. Oh, the Intel. Thank you. Okay.
Hear them on, I don't know if they can hear us. We'll get all the logistics worked out here a little bit with the other sites and figure out what we're doing. So to start out with, all of you within the general category, family support worker. Is that a way of saying that? Or what do you do if you're not family support? Anybody want to help out? I know it's early. You can do this.
We're in the school setting.
The school setting, okay. Anybody else want to volunteer over here?
People can sit by me.
I can tell I'm going to be pulling things out of people today.
We have family support workers in our agency and independent living specialists also that are here.
Okay, okay. But But most of you are doing direct service in-home for the general category for most of you. Okay. I'm going to run through this, and hopefully as you go through it, it'll help you visualize the people you're working with or the job you're currently doing. If you have specific questions, I hope we'll have time at the end to do that. But I'm going to run through it fairly quickly. I probably need to get on the other side of this so I'm not always looking up this. When we talk about through the lifespan, I'm going to talk in general terms more than psychology terms a lot of the time, because I think that's the language you use when we're working with people every day. Because the first step, when you look at this, I started out here with family history. So you're basically talking about, it looks like genetics, pregnancy and delivery, 1 to 2 years, 3 to 6, 7 to 10. Those are kind of the developmental stages that we go through. And if you had developmental psychology, those are kind of general areas of development that you see major changes in maturation during those times. And the specific things to happen, on top is kind of the normal development. Underneath is if when we talk about trauma coming in, and we'll talk about that more as we go. So family history-wise, I'm looking at the genetics there. If I meet a family, when I interview them, what's happened in their family before? Is there a history of schizophrenia? Is there a history of heart disease? Is there a history of epilepsy? Is there a history of, are there significant medical or mental illness histories there that they've said, oh yeah, my uncle did this and my grandma was this, and it starts to give you a picture, a little bit of genetically what might I be dealing with in this family. The other part that I always like to look at it when I talk about, especially with individual kids or families, is temperament. Temperament is the part of personality that a large part is inherited. If I go into a nursery and I drop, in a hospital, and I drop a book on the floor, some babies are going to wake up and, and crying, can hardly calm them down. Some will wake up and go, go right back to sleep, but some will just like, on the face of the bed. Also, that's not learned. They're 2 days old, they're 3 days old. They haven't learned that yet. So that's part of their sensitivity to stimulus coming into their lives. How sensitive am I to things around me? And that's a big part of our temperament. Many of you know children. You can take them anywhere, they can eat anywhere, eat anything, sleep anywhere, get along fine. Some, it has to be absolutely quiet, it has to be the right food, you have to hold them the right way, or you can't comfort them, can't soothe them. And that's part of that genetic piece that comes in. A lot of times I like to read pioneer histories. A lot of times they'll talk about people being high-strung. They'll use a lot of different words for it, but it's basically I'm pretty overreactive to my environment from day one. I have that temperament. And then, again, that's going to make a difference as you go along if we start to introduce all the other things in the life, family and trauma or history or anything else that's happened to them. But I'm starting out that way, and that's the whole part of the family history is I need to kind of have a baseline of where they're at when they start. That's going to give me a little idea of that. When you talk about pregnancy and delivery, again, I want to hear about how that went. Gee, I was drinking and drugging, and I didn't know I was pregnant until I was in the 6th month. Well, that's going to give me some ideas about what might be going on here. Then if somebody says, oh, I don't drink, I don't smoke, I really tried to exercise and eat right. I have a real supportive family environment, and they made sure I did that. Again, getting a better picture for what's going to be happening there, because then if that normal development, if I have that good nutrition, good support, low stress things that goes on during the pregnancy, good chance that, again, I'm not going to have some additional issues as far as brain functioning or medical functioning. Also, too, when you look at that, talk about chemically free. There's a lot of information out there now, and I think we see more of that today of people being more mindful of whether they're drinking or smoking or using even over-the-counter medications or different things during pregnancy. But we know that a lot of the people we work with, again, may not know they're pregnant, or they have a lifestyle within their family or extended family where that's part of it. They continue to drink, they continue to smoke, and it's not to be judgmental of that, but then we need to be mindful of it, though, that it's going to have an impact in that situation a lot of times. Some kids get along fine, you'd never know the difference. Some kids, that's very, can be very impacting in their ability to function. Well, and we'll go the other side. We're going to get along here. One of the other things that was that removal concerns on the other side of that is that given family, a little bit of that family history, if I have someone who has had children removed before, especially at the hospital because they see a high risk, again, that's going to add a lot of stress to that mom going into that if there's been a prior history of that. You know, hey, mom had kids removed, or my sister had kids removed of that. That adds a lot of stress to that individual. They think, hey, what happens if they take my baby? You know, despite my best efforts, maybe something might happen. So that's another significant stress level when we talk a little bit about history. Talk the first and second years, if delivery goes well, and again I say delivery because a lot of times people don't always give you that information. That, you know, the cord was wrapped around their neck, there was action debt there, we didn't make it to the hospital, we had her at home and so she had an infection. There might have been some complications at delivery as well, which again is brain functioning and medical functioning. So a little bit of an idea there is, you know, how'd your pregnancy, how'd delivery go? Oh, okay, okay, in a normal situation, again, those things are all good. We're not going to have things that are going to impact them later. So when we get into the first and second year, look down here at the bottom here. It talks about, in the first year of life, one of the major psychological things that, steps that we have that are the basis for kind of how we see ourselves, how we see the world, not just personality, but our emotional functioning is based on. Is in that first year of life, it's all about trust. And if you look at the top, it says needs. You know, all infants have needs. They need to be fed, they need to be rocked, they need to be changed. And in turn, they're going to give you what we call a rage reaction. And that's that cry that goes, it's that screaming, piercing cry. It's not the, I'm mad or I'm uncomfortable. It's that one that if someone doesn't answer, I literally will die. If someone literally never answers that cry, I would die. So it's that real deep-seated, and I use rage because it's all the emotion. We think of rage as an adult term, but in a child, it's that piercing cry because it's a survival cry. Hopefully someone comes in and provides, again, what do? We hopefully give them a bottle, we provide them with food, we smile and reassure them, we give a lot of eye contact and connect with that child. Again, we're talking about attachment. But in turn, it's more than that. It's like, hey, you're okay, we love you, and I go pick you up. And it talks about movement. It's that rocking movement, picking up, rubbing their back. Whether you rock or whether you actually do the pat or whether you walk around for hours, whatever you do to help calm that child, but you're giving movement. And in turn, out of those four things, more often than not, then you're going to get, the child is going to get some relief from whatever pain or discomfort they had. They're going to get some gratification. Those are words we use, but in the child, they calm down. They seem to be happy, go back to sleep, whatever. So in turn, trust starts to rebuild. Because I know if I cry, this new unique person comes in and does all these good things for me. And I get to do that literally thousands of times during that first year of life. And that's a big part of attachment or bonding to that individual or the people around you. And it says, hey, I'm going to reach out because I know if I cry or reach out and know what's going on, someone's going to help. Someone's going to come in and take care of me. Talk about the flip side of that in a little bit. Because that's important because as we go into the second year of life, what happens with the twos? Twos are all about, as it says, control. So, and as you get into the second year and towards the third year, you end up kids, that's the first time they can walk, talk a little, but they can be independent of their caregiver. I can get up and get around. I can get away from you. So in turn, there's that independence part. So then that control piece starts to come in. And the control is the same way. All kids, in this case, we talk about all kids have wants. I know I want to get under the sink, I want to get in your purse, I want to see what this tastes like, I check everything in my mouth, I'm checking everything out. And that is my job. At that age, I'm exploring the world. I want to find out what the world's all about, so I'm into everything. Hopefully, again, people come in and set limits on me. No, honey, can't have that, take that out of your mouth, can't go there, can't do this. And any good child's going to give you what says negativism is the actual word, but I say it's just flack. They're going to throw a fit for a little bit. Yeah, no, I want to do this. I cry, I scream, I might throw myself on the floor a little bit. If I throw a fit, I give you some flack about that. But if that first year has gone well, and I have that bond with that caregiver that I know is comforting and loving and caring is a good thing, I'm going to basically come back and comply. I'll give you a little bit, but I'll come back for you. Because that's, I don't want to be out of sorts with you because you're my source of food and love and comfort. In turn, that child obtains what they want, which is independence. They get a chance to explore more, do more, be able to make that, go away from you and come back, go away and come back, which is what they want, is the chance to explore more in their world. And we need both of those. If I don't trust, and I don't have people have control of me, if I can't do it when they're 2, I'm darn sure not going to do it when they're in junior high or high school, or even when we have 40-year-olds or 50-year-olds or 60-year-olds who are in and out of the prison system. At some point I have to learn to trust and allow control of my life and know how to use that. This is the very basis of this. When we talk about reactive attachment disorder, we talk about those really significant mental illness, behavioral problems especially, this is where we see it. When you talk about, to me it was multiple personality disorders, now it's what? DID. But basically, if I see multiple personality disorder, usually that's severe trauma and usually sexual within the first 2 years of life. There's a history there. That doesn't just come out of the blue. That's one of the things that happen because the trauma is so severe, the brain splits to cope with it. Just like you do, you take your mind someplace else. If you're something and you're bored out of your gourd or you're scared or whatever, you try to focus on something else. Well, if you do that early enough, your brain really does separate and you have paralleling pathways of consciousness. And so that's kind of the basics of that. So these first 2 years are critical. And that's why when we look at, a lot of times when at home, most of us don't get involved too often unless it's at the hospital when they see that risk, or it's usually 3, 4, or 5, because that's when they start to engage in school, preschool, other things, and people start to see that difficulty or that disruption in the family, or the child struggling. And so a lot of times we miss this 2-year period. We're coming in later. We'll talk about that more in a bit, but this is really important. This is the basis of who we are. And it's really hard to go back and, when you do therapy, when you try to do characterological restructuring, which this is about, it's extremely difficult to do. That's why reactive attachment disorder and a lot of things are so hard to treat, because you miss the basic beginning milestone, or it's at least complicated, or it has issues with it. So it's nice to understand, but part of that is when you go in and see a family, do you see that? Does the child, when they cry out, do they get response? Are they easily, are they easily comforted? Do you see those types of things? In a normal development, you do. All kids throw a little bit of fit, but they basically come around and sit down on mom's lap, or they go out and do this and they come back. And you see that comfort factor that's there. You don't go, whoa, because you sense that when you're in a situation where the child's extremely out, or the mom is extremely overstressed, or, for a better term, doesn't know what to do and reacts themselves. And we'll talk about more of that into it, but again, those first 2 years, and that's why I separated it out, because it's trust, control, attachment. I put in here feeling ID, and feeling ID is the thing is that kids have to have a language to know what they feel. Do other people around them say, oh, honey, you're really disappointed, or you're just scared, or it's all right. As a parent, am I modeling and labeling those emotional experiences so that child starts to develop a feeling language to be able to tell you what's going on with them? If I can't tell you about it, I can show you, but it's a lot better, again, as we know, with therapy and with school and with all of our other social interactions. If I can talk it out, it's a lot better than I have to enforce to work it out behaviorally. So I want to see if there's that feeling identification where you see kids understand their feelings, or start to feel to label that. And a good 3-year-old can say, I'm mad, or I'm sad, or I'm scared, or I'm lonely, or lately I've heard some that said I'm bored, and I thought, I don't see how you can be bored at 3, but I understand that is they don't know how to entertain or sympathy. But again, I'm feeling ID. The other one is in or out in focus. back to this first year of life stuff and the one thing, but is if no one answers that cry, in the extreme form it's failure to thrive. But and most of the time is if every time I reach out and say I'm hurting, and people don't come, or they come on kind of an irregular basis or not in a systematic way where I learn to trust, I literally stop searching. My focus starts to become more inward. Even as a small child, you'll see it. They're into what they're doing. They stop searching the environment to see the people, or reach out to people, or to have a sense of improvement, approval from people, or I want to get along. I want to reach out to other people in my life. I want to reach out, and I notice the environment around me, so I'm aware of what's going on. If somebody asks me to do something, I understand a little bit of that. Even, a good 2-year-old can go, oh, I'm supposed to pick, when I'm told to pick up a toy, I know what that means. If if there's toys on the floor and I keep falling, and someone tells me that, I'll pick them up, or I understand to that extent a little bit. You'll see that recognition of putting it up and then walking through the room. If I experience that where someone doesn't answer that cry, and I get inward focused, I stop looking around. I stop looking for mom's direction or dad's directions, or seeking out other people for assistance or to understand what's going on in my life. I literally get so focused on me. I'm doing what I'm doing, and you're just happen to be there. Again, in the extreme form, we talk about it being reactive attachment disorder, but what most of the time we see is kids who are just clueless. You see them in a room where, well, didn't they see that? Didn't you see that you were hurting somebody else? Didn't you see that they were doing this? Or you start to see that awareness of where they really notice the people around them. And they're focused outward, not just what's going through me and what I want to do at this impulsivity at that given time. And that really starts to develop during this time frame based on how this goes. So as we get into that 3-year-old, that really makes a difference, because those are the kids who respond to adults around them. That trust, control, they're looking for the environment, they want to learn, they like to do stuff because they're looking outward at what you're trying to introduce into their life. Kids that don't, they grab what they want to do and they go over in the corner. Or they grab it and fight with other kids because this is what I want to do and I want to do it, and I don't care what's going on around me. I really don't pay attention to, or if someone's giving instructions or I hear another voice, I don't look up and see what's going on. I'm into my thing and I don't care what's going on around me to that extent. And that starts very early on, that inward focus or that outward focus. Again, as you see into adulthood, we'll talk about it. Do I see the control of my life? Do I have control over it? Or do other people have control over it? If I'm an outward focused person, I know that I can make a change. I'm in charge and I can do this. If I'm inward focused, I think stuff goes on out there and it just hurts me all the time. It's always somebody else's fault. Things are always going on, and it doesn't have anything to do with me. It's going on out there, and I don't have any say in that. If I'm the flip side of that, I feel like I've got a say in it, and I'm watching, and I know if I change my behavior or do something different, I can impact what's going on around me. I can take care of me. It starts very early on, that sense of inward focus or outward focus. And that's, again, when you start looking at families or looking at children, they have that. And again, all things are on a continuum. I would say a circular continuum, because they don't have it all or not at all. They've got some of it, but to what extent are they able to do that? What level are they able to do that? Questions so far? I see you're going.
The thing that, and again, I've heard you talk before, and I've done this for a long time too, but you keep forgetting what you were talking about at the very beginning, just the cord was wrapped around your neck, just those little things that happen at birth that we don't think about asking or we don't take into consideration, right away. I think that's a very good point, that we need to always keep that in the back of our mind when we're working with families and everything. But the other thing, when you were talking about the trust and everything, is that where empathy comes into play?
Sure. If I'm not aware of what's going on around me, I'm not aware of my own feelings. I know what I want, but I don't care what's going on with you. How do I empathize with somebody I really don't even bother to notice what they're doing? And you see, especially as you get into junior high and high school, that's when you see the kids go, wow, Well, didn't you notice that? Or didn't you see how you were hurting them? Or didn't you, you know, you want them to have that awareness. And it's like, they seem clueless. They're just not there. And you're like, where did that come from? And a lot of times we see that as a choice that I'm just not going to do that. Rather than the fact is, that's how they function. You start to notice is that's their pervasive way of interacting, then what we do to help with that changes, and that's when we talk about treatment stuff, that's going to change that focus on what we do. Is this a child who usually does and is now mad and just refusing, or is this a child who never has had that skill, never had that development? So, yeah, I think the biggest thing too, with the, as we now know with the brain studies, traumatic brain injury, or even with trauma, it literally rewires the brain differently in children who've had, especially early trauma, than children who haven't. So there's literally, you know, that biological difference in the brain, those that come on. And we used to didn't think that, you know, so kids got over a bad concussion. You think about some of our little guys, how many concussions they probably had that family doesn't even talk about. Oh yeah, he fell off the stairs, he was kind of out of it for a while. You know, they make those types of comments. Well, how many times does that happen? Oh, he fell off the stairs once, and then one time he fell out of the car when we were getting ready to go, and once, you know, and you start getting these histories, you're like, this little kid, I'm sure if we probably did an MRI on his brain, probably might have some deficits in there of where some of that stuff's not online. But to them, it's just life experience. And we used to think of it that way, but now we begin to understand, now when somebody hits junior high or high school or as an adult, whoa, you know, where's some of this stuff coming from? And they've had some things. I was thinking of a young man who was riding on the back of a motorcycle with his dad, and they had had a wreck. One thing that, which was one information they had not given me, you know, in the first probably 6 sessions, and we were still talking about this then, and I just kept coming back to the fact this was a young man who wasn't making choices, bad choices. He made them, but it wasn't like, screw you, I'm going to do this attitude. And finally one day they said, well, it was kind of different after the wreck. Well, what wreck? And they started talking about it. I'm like, both he and his dad were severely injured in a motorcycle wreck. Didn't bother to share that at all. And you're like, that's pretty critical information. And to them, it's like, oh yeah, we lived through it, so what? But, oh man, that made a huge difference. And beginning to work with doctors and beginning to work and start to see that, hey, this young man has pretty significant brain injury. And was compensating the best he could all those years, but no one ever thought about doing it at that time. So, you know, doing those histories is important to see that, because that's going to give you some clue there.
What do you consider, like, trauma, you said at a young age where it's going to change the brain function? What's the young, what, do you have an age range that
Anytime.
occurs?
Yeah, babies. I mean, again, if you do the MRIs on rad kids, you know, kids are really severely, well, failure to thrive kids. Now, if you do a brain scan, you'll see it. I mean, there is areas of brains that are just not online. And then areas that should be calm are really overreactive because they don't know how to calm, you know, they don't know how to focus or calm or what to pick up on.
So by the time they get to junior high or high school, is
The
it
brain
still
compensates. I mean, sometimes it comes around and compensates, you know, it works around it, does a little bit. Depends on kind of what that situation is. I always look at the fact that if you have, the best examples I know is when unfortunately, when kids are removed or maybe they get adopted, and you see 2 or 3 years down the road, they're different. They're in a very structured environment, nutrition's different, they've had extra help in school maybe or at home, and the brain's very, you know, it's got that placidity there, you know, it's very plastic in the sense that it's moldable. There's some things you can't go back and do, and we don't have time to go through all that here, but in turn, if they get some of that, yeah, it'll start to help with that.
And so if the trauma occurs at like 5 years old compared to like 15, there's going to be a difference in how because the brain's forming
Yeah.
more so when they're younger.
That's what we're going to get into a little
Okay.
bit here about. When things happen, makes a big difference on what
Yeah.
type of treatment we're going to look at. Okay, I'll move through this a little better here. 3 to 6, we talk about acceptance, belongingness, valued, emotional regulation. That's the kid, you know, when I'm 3, during this time, that's when I need my parents to think I'm the best thing in the world. I need, oh, you're cute, you're pretty, oh, I love this. You know, I'm the best thing since sliced bread that came to their life. And I need to feel that. You know, I need people I feel like I'm accepted, people love me, they want me there. I walk in the room and 5 different adults say, come here, come here, come here, you know, and smile at me and reach out to me. I get that type of reinforcement that, hey, I'm accepted, I belong, this is my family, my house, my room, I belong here. I'm valued in the sense that that's the whole part of self-esteem is, oh, I'm so glad you're in my life. Oh, I love you, honey. You bring so much joy to me. I get all those affirmations that say, you know, you're here, you're great, you're wonderful. And I need those at that age because I don't know what that means. You know, I need to have that sense of really strong bond relationship and that I myself am part of that. You know, I belong here. I'm part of this. Skill mastery, this is when we start getting, you know, I can walk, I can talk, I can start to do things for myself, I can put my shirt on. You talk about potty training. I'm not going to get into all that because that's sometimes a whole nother deal. But basically, I start to be able to do things. And that's that, you know, and it feels good. That's where a lot of our self-esteem comes from. If I'm able to do things for myself, I can do things. And in turn, the adults around me say, oh, that was great. I'm really proud of you. Man, you did that well. Again, I'm getting that whole cycle of mastering skills, getting rewarded for that, and in turn, kind of on our independence level, I get to do more. You know, if I'm willing to get out and brush my teeth and put my shirt on, I get to watch a little TV before I go to preschool, or I get to go do something else, or if I use the toilet, I get a treat. I mean, I really start to see there's a rhyme and a reason for why I do what I do. And so I'm reaching out. Likes and dislikes, you start to see that. You know, are they an inside kid who loves to play, read, do stuff, or are they outside all the time? Do they like playing with things alone, or they like to play with other people? Not alone because they can't, but they, you know, they kind of choose to go off and do stuff for themselves. They're kind of into their own stuff a little bit. Not in a bad way, but they're, you know, some are a lot more social. They want, you know, 5 kids over to play for a play date, and others are like, I just want my friend. I just want the girl I met at preschool, you know, or I want my cousin. And at this age, more often, not, again, family is, put on there is family is your main source of reinforcement or teaching or learning. And they're the main source of people who are their cousins. Most of those brothers, sisters, or cousins are the first people we practice our social skills on. You know, that's where you fight, learn how far you can push, all those things, and in a very safe family environment with people who have connection to you. Which is important, because if you have to practice that in your 20s or 30s with strangers, it doesn't go near as well. So I want to learn that then. Part of that, you know, of likes and dislikes, and it's really important, you know. I already start to feel what I kind of like to do, the things I enjoy doing, which really are interest to me a little bit. And then I said sexual ID. This is the only time, again, there's no real sexual development from here till puberty in development. That's what we call, if you study psychology, latency age. The body's not doing any sexual development at that point. So in turn, what you get right here is little boys who play with themselves a little bit, little girls, and I'm a boy, I'm a girl, I'm this, I'm that. You know, they start to identify a little bit in their sexual identity or orientation. If you do histories with transgendered, or you do histories with lesbian or sexual men or, you know, or women, a lot of them, you know, are going to say this is when they first go. I knew right away. You know, they'll go back to this just before school age and say, I was more comfortable with this. I always thought of myself this way. You're going to see that because that's that first real sense of that, and that's the first indication a lot of times of where we know how the brain is sexualized versus the body is sexualized. Because you can do both. That's part of the modern stuff of brain studies. We know that a lot of times in that 2nd, 3rd, and 4th weeks, up to the 8 weeks when testosterone comes in and acts on. We're all female to start. Testosterone acts upon that. What's the official term for that? It's not embryo yet. But and in turn, that's what identifies the sex. And sometimes the brain is all male and the body's all female, or vice versa. That can happen. Or a variation of that. Again, we're talking about continuum. Most of the time, it goes what we consider normal, where it lines up. There's no issue with that. But that's when you first start to see that if there's issues. But the other part is, it's really important for little boys to know, I'm a little boy and this is my dad, and start to differentiate between how people are there. You'll see that. But then once they hit school, it's like, that's kind of a done deal. Because again, the body's not dealt. That's why, and we'll talk about that more, when you see sexual stuff between there and puberty, that's why I'm going to start like, and where's the sexualized behavior coming from? Because otherwise, they don't have anything inside of them going, ooh, you know, thinking sexually or any of the sexual stuff. There literally is no sexual development then. So in turn, that's why as we get into the 7-10, you know, when I talk about in there, is that kids are so focused on learning and doing things, going places. They like to be with people. That's why in schools you do so much memorization type of learning at that time, or foundation learning, because they're just soaking up like a sponge. They love to do stuff, and we're all that way. We're taking stuff in at that point because I'm not having to deal with what's going on inside my body, my mind, whatever. Again, in Nomerville, I'm not inner-focused at that point. I'm really out here. When you talk about social skills, that's when I really start to go from just, getting along at home and maybe with some cousins. I have to start really getting along with other people out in the world, in a school environment. So I have to learn all the social skills to go with that. I'm not going to go into detail there. The desire for learning is there. You see that real strong desire. I want to know things. I want to go places, do things. How do you do that? Can I play this? Can I do this? Usually it's kind of guiding them because they want to do it all, and you can't do it all and as parents, so that you try. Emotional intimacy. This is a big one right here. Emotional intimacy is that ability to be so close to someone that they almost know you better yourself, and it's outside of family. Initially you feel that with family, but this is the first time little girls and little boys have their best buddies, their best girlfriends. They have their bests. And oh my goodness, we walk alike, talk alike, dress alike, do everything together. And there's a lot of physical affection. We hang on each other, touch each other, but it's not sexual. Again, we don't have the sexual stuff on there. That hasn't been introduced. That it's pretty innocent. But they're just all over each other and just they're so close. And that's the first time somebody outside, usually their family area, that they have that with a peer. And we need that with people where we have that sense of emotional closeness that's safe. It's not a sexual thing. It's just an emotional closeness that we know somebody so well and so comfortable with and we trust. Hobbies and interests. We're past kind of likes and dislikes. I really start to develop in this time where I have actual hobbies and interests. I start collecting things, or I start playing a certain sport or an instrument of music or something. I take that and it bumps it up a lot, jacks it up. And again, that's important, because think of the kids we work with who, what do you like to do? Nothing. Do you have any interest? None. They don't want to do sports, they don't want to do music, they don't want to do anything. They don't have an interest in it. So it's really hard to motivate somebody who really doesn't have them, something that's been nurtured in them based on their natural desires of what they like. We want to see a lot of that start to happen. Above here I have, in the big category, self-love. This is all about learning to love myself. And as we talk about things, you'll see these down at the bottom. Those are not little crosses above them. Those are actually plus signs. Because as we go through life, I learn this, plus I start to add this. Plus I start to add this. Each one of these things, as I'm adding these into my repertoire of abilities and interests and talents and growth. So I'm doing the self-love. Then I get into the friendship love. I learned to have friends that are so close. And that's my job right there. Because as I hit, again, 10, 11, 12, what happens? Puberty. And puberty changes everything, because now I'm going to throw in the sexual stuff. Because I'm no longer innocent about that. If I haven't been abused, I'm going to be innocent about that. And in turn, my body starts to change. I start to be a lot more emotional. I start to have desires I don't understand. I look at boys differently, who I've been my best buds before, and now I'm like, oh, this kind of feels different now. Same way and vice versa. You start to see that change. I always talk about the fact that the brain takes this kind of last level of development right there when you get into, you end up going from concrete operational to abstract thinking. Kids don't think like we do up until this point. They can think about thinking about that way, but they really don't think that way. They can't think of complex issues. They don't see all the variables because they don't have that sense of insight. And the way you know that is, how many of you remember when you first became so self-conscious you couldn't walk into a room? That's puberty. That's that insight in the beginning of abstract knowledge, because I no longer look at things. I feel it. I sense it. My very being, I know everybody's looking at me. I know there's things going on around me. And I don't have that before that. Kids younger than that, they don't have that. They might talk about being scared or something like that, but they don't have that painful emotional thing. And that's a good thing, because we need to have that before we sexually can physically act on that. I think we're made that way, so we have that ability to abstract think before that kicks in. But that's the important part of it, is that sexual intimacy starts here. Hopefully, not till later on in this age, But we know that a lot of times that is, because that's when sexually I literally can, I start to have that relate to people sexually, not just socially, but there's a sexual component to it. And I have not only know social skills, I have no relationship skills. It's different getting along with little boys who are now sexual than it was when they were just buddies. It's different getting along with other girlfriends who now are sexually, because then all of a sudden there's this issue about if you both like the same guy. Or, you know, oh gee, I look at my mom and dad or my brothers or everybody in my family differently now because I'm now aware of this. I sense this. So I'm learning relationship skills, not just social skills, but relationship skills. Hopefully that goes well, and you know, moms and dads are modeling good stuff for me, telling me how to do things. I have friends who tell me, oh, don't do that, and knock that off, or this is the best thing, or whatever. They're giving me good advice, and are good and supportive. Self-regulation, I really know how to regulate myself. Kind of messed up over here because I think I left emotional regulation off on this regulation, emotional regulation. Is I learned how to self-soothe. I learned how to calm myself down. I learned how to, oh wait, I can't do that. I stop myself. I can stop and think about things, make better choices. And then the other part is education and careers. During that 12 to 18, what do? We start to think about what we're going to do with our lives. We're focused on high school. Hopefully, am I going to college? Am I going to do a trade school? Am I going to go right to work? You know, I'm past, again, interest in hobbies. I'm talking about, you know, what am I going to do with my life? What do I want to spend my life doing? And so, I'm bumping it up that next level. Hopefully that goes well. There's people in my life. I already know I've got some interest. Gee, I think I want to go into nursing, or I want to go into this. I want to teach. No, I don't want to go to college. I think I really want to go to trade school. I want to be an electrician, or I want to do this. You know, I really start to have that sense of where I'm going to go with that.
Where did you say emotional regulation went?
Emotional regulation, I should have put it back here, that's part of 3 to 6. I touched on it, but I didn't go into it real.
Oh, I see it, okay.
But that's when, you know, that's that thing when kids, you fall down and somebody comforts you and you learn how to comfort. Or somebody really makes you mad and your mom talks you through it and realizes that some people are going to disappoint you. You can't deck them. You know, you've got to talk it out with them. You'll start to learn those things. And in turn yourself is, okay, you know, most parents are going to rub your back and say, I'm really sorry this happened, but suck it up, you can do this. You know, and you learn to go, okay, I can handle this. That's that emotional regulation. That's what you're teaching. You're teaching just to emotionally regulate. And we all know people who don't. And regardless of, but that even gets more when we get into sexual stuff, because then it's not just more emotional, it's the physical regulation. Stop myself. If I have desires, I can't just go with it every time. So I have to have both body-wise or, you know, behaviorally wise, as well as emotionally wise, a lot better clue on how I relate. 20s to 28, you get the independent living skills, choosing a mate, child rearing, parenting, employment, pastimes, and causes. Again, we take it up a notch, but the independent living skills, how many clients do you still have older kids living in the basement? Yeah. How many kids do you have adult families still living with grandparents? You know, what happened to that? You know, I'm supposed to leave somewhere along the line and get out on my own. You know, I have to learn to live independently. Both emotionally, how do I handle being independent? You know, being on my own, making decisions, handling responsibility. I've got to get that ability to do that. Also, can I make a budget? Can I get myself to work? Can I make sure I, you know, don't plug up the plumbing? Do I know how to make an appointment so I don't, you know, those independent living skills? And that really shows. Some kids go into service, some go into college, some go in places where it's kind of semi-independent. They've still got some structure, still got some help, but it's still there. So, you know, that helps change that. The child rearing, choosing a mate, again, we're talking about that's early 20s, the late teens. A lot of times people already have kids by then, so you're already into that. We'll talk about that on the other side. But basically, hopefully, most people, more often than not, are going to choose somebody. They're going to choose a mate. They're going to choose somebody they think they can be in relationship with, that they love, that they care about, they want children with, they want to have a life together with. Before I add kids into that. Ideally, you do that just because it's a lot more fun. There's a lot financially and emotionally, it's a lot less stressful if it's done that way. But again, you're starting that whole thing about developing a family and starting a career or finding a job. Again, if we go to look at the other side, what happens to a lot of our people? They never make that never happens. They're still at home, still unemployed, still can't find jobs, go from job to job. That's another critical step there, that if I don't have all these skills, I can't do. You know, in the 30s, you're looking at family operation. Do I set up a successful family? And that's just not finding someone. That means, does our family function? Do we get our kids to school? Do we have food on the table? Do we have a place to live? Do we have a car to take us places? Does my family operate? Does it function well? Hopefully, you'll see most people there are pretty well settled, whether they rent or buy or whatever, but they've got a place. You know, they've got those basic family operations in place. That put, again, establishing a home, career building. If they didn't go to school or did go to school, they start the job, kind of go, you know, I think I really like this, so I'm going to move up in my career. I'm an LPN, or as a CNA, I want to be an LPN. I really kind of liked working at the grocery store, but I think I really want to go more into more business management. I want to try for working at the bank or moving up as a manager position. You know, am I thinking about those terms of not just working minimum wage job? Am I start to look at, can I build a career around this, and do that? Community involvement. Hopefully you start to see, these are people who, because they are fairly stable, they start to give back. They are the softball coach. They are the Little League people. They are the Awanas teachers. Those are those people who, you know, hey, I know I can work with my kids. I'll go out here and help other kids. I'll do things in the church, in my community, and, you know, you'll start to see that community involvement piece. That's why I start to give back. And again, if you see that, it's like, that's still part of that self-esteem building. As an adult, that feels good. Because you know, when you keep your family, you're feeling really good about helping the people around you, and helping your community, or helping your church, or helping whatever you're in. But hopefully you start to see that. 40s, you get into, you know, start to reevaluate. That's when they talk about midlife. It used to be 40s, now they talk more about 50s. But usually if you've been into it about 20 years or so, people got to go, this isn't what I thought it was cracked up to be. I don't know if I really like this, or I really like this. I start to do a little bit of life thing, because I'm busy raising kids and doing stuff, but it's starting to get on the, you know, maybe a little on the end of that. And I'm starting to think, is this what I want to keep doing? Is this, you know, we want to keep living here. You see a lot of families move at that time, think, you know, we could really do better if we moved here, closer to family for support, or a better job, or that. Because before that, you're too busy trying to get set up to think about, is this really what we want, and do I want to make a change here maybe in the next few years? And so that starts to build in there. Talk about care of parents. A lot of times, again, you have adult children living in your home, and that's an issue there. But also, that's more often not when you start to see if your parents had children later in life, you start to have some parent issues. You have to take care of your parents. You know, mom can't do this anymore. Dad passed away of a heart attack. This happened. All of a sudden, I'm starting to get that older generation. Developmentally, I'm starting to have some care of older people in my life. And that's about when that starts to happen. And that's a whole nother added stress or added thing. If I'm doing pretty good myself, I'm in a position to probably help with that in a good way. Get into my 50s, midlife changes, health, what? Again, for women, you're going to start looking at menopause, so that changes things. You're not going to have kids anymore. That comes with a whole host of other medical things that can happen to a lot of women. And so you start to deal with that. For a lot of men, you start to have a lot of health issues, but not because of menopause. But if you're a smoker, drinker, some of these other things, that's usually when you start seeing more heart disease, more liver issues, more other health issues start to come out. High blood pressure, diabetes, type 2 diabetes. That's when you're going to see this really start to flare or pop more, about that age time. Then in turn, but hopefully if that's going well, you get into your 60s and then you start looking at, you know, talking about children returning. You have to look at, are they out on their own? Deaths in your life, that's a lot of times when older parents, or not even just older parents, but parents, aunts, uncles, a lot of times peers, other peers that you have in your life, you start to lose people in your life. You have to start dealing with death issues or sensitive life issues. Death of elders, they talk about the thing about retirement. For most people, that's retirement time. And so then you start looking at, okay, I'm not looking at building interest. I'm going to shift. You know, am I retiring to not do anything? Am I retiring to another plan? Do I have enough money to go into another business? You know, what am I going to do after this hard push working time has been done? My kids aren't home anymore. You know, what can I do? What do I want to do? So it's another real evaluation time of, do I have a lot of sense of it? All along, have I had hobbies, interests, things I wanted to do that now, oh gee, now I can go do that, or I'm at a loss. You see a lot of people that, well, what do I do if I don't go to work? Do you have any interests? No. Do I have any hobbies? No. You know, it's really hard. For a lot of women, that's hard if they have men in their life who are that way, because they don't know what to do with themselves, so they end up bugging wives, and wives are like, oh, finally, you're not so busy, we can do some other things, and no. Somebody wants to travel, somebody else doesn't. So in a healthy way, they can do that. Again, in the 70s, you get, again, more family involvement, death of close friends, and people start doing a life review. You know, has my life been okay? Do I feel good about my life? Because that's a big quality of their quality of life at that time. If it has, I'm feeling good, pretty good about life. I have grandchildren or great-grandchildren or, you know, people in my life that I am around. I feel really good and settled. Again, the last part that I talked about, sepsis or belonging and cared for, that I have people around me in my older years where I'm not alone. And whether I'm in a facility or not, do I have people that are regularly in my life? Now that's kind of the fast version of normal. How many of you see that in the families you work with? Come on, help me out here. Even from the other sides. Do you see that? Not usually.
Not normal.
Usually they're a little bit left of center, a little right of center, not quite there. Those things don't always happen for them. And you asked earlier about what happens. And we'll jump right into this because I'm looking at time. If things go normal, you know, if family history is okay, those things are okay, that's fine. If I have a family history of severe mental illness, or I have issues, you know, functioning impairments, I start out that way. I've got a child who's already limited, who has special needs from day one. You know, how do I deal with that? I talk about that on that pregnancy delivery. That's a huge issue. If I'm somebody who's really struggling, if I'm one of those people who have disruption in my life and I'm not functioning well, and I have a child now who has special needs, it doesn't work well. I'm having a hard time struggling taking care of myself. How do I take care of this? Not only take care of it, it's fearful, but I'm being overwhelmed, but also grieving. This isn't what I thought I was going to have. This isn't when I thought about having a baby, this isn't what's going to happen. And for some people, they really struggle getting past that. It's not fair, it's not right. You know, we talk about it, if that trauma starts in there, I think, you know, everything around here has happened to me. You know, stuff always happens to me. This is a real screw job. I shouldn't have had to deal with this. Why do I have to deal with this? You know, that whole anger piece, because I know how to grieve the fact that this has happened to me. Again, families that are functioning, it's hard, but they cope with it. They find a way to deal with it. If I'm not a functioning folk, if I'm not a person that can do that, I don't. I usually use custody. Or I have to have a lot of significant other people in that, you know, you guys are going to be in the home a lot because I don't know how to do that. Not only just because I'm overwhelmed and it's hard for me to want to do it, but because I'm so hurt and disappointed, I've lost my desire in some ways to do it. That's hard to deal with. I really have to grieve the loss of what I thought I was going to have. Trust and control. If we, you know, that goes well. Let's say those things go well, and abuse or a trauma or something really significant happens, you know, in that first and second year. That's where you get the failure to thrive. You know, neglect, the abuse, the overall controllable issues, misuse, you know, misses a lot of milestones. These are the kids that, you know, Child Find picks up. They have speech issues, they have behavioral issues, they have learning issues. The biggest thing is probably that gets them most trouble is the control issue, You know, come get your kid. You can't be at preschool. You can't be at daycare. They're too uncontrolled. Get into school, same way. So we've got to do testing. We've got to get an IEP. We've got to get all these things in place. And again, I'm going to look for what's going on there. You know, what's that child exposed to? Again, if I'm a person, if I'm an adult and this thing's happened to me, then what's going on here? I'm going to flip back and something Tom here, is that we all need these things. And so if I see somebody, I know it's kind of reverse here, like somebody comes in, most people don't come in until their 20s or 30s or they're referred by the court. So about 20s or 30s they're going to show up. And you start to look at that. One of the things I really want to talk to them about is what was going on in your life at that time. Because if they're dealing with abuse or trauma, they're not doing the normal developmental stuff. They miss that piece. if in my first few years of life, mom and dad, or just mom or dad were drinking, drugging, not around, struggling, depressed all the time. Even if they were trying to work, they were gone most of the time, and I was with umpty million different babysitters or mom's boyfriends or dad's girlfriends. I wasn't doing in this trust control stuff and learning how to do this and being told I was the best thing since sliced bread. I didn't get any of that. So in turn, what I'm going to see when I see somebody like that, if I see somebody who emotionally they don't have a sense of good self-esteem, they're really struggling, you don't have that sense of self with them. I always say that the analogy they always use is like the difference between an onion and an apple. An apple has a core. So if you strip it away, you can see this core and you think, okay, they've had some struggles, but this is this core person. If I get an onion, that's a person who really has struggled in those first couple of years in life. You keep peeling back layers, finding that core, and you never find one. They really don't have that solid sense of self. This is who I am. This is what I believe. They really don't know themselves. When you look at, they go into individual treatment, and we'll talk about, they really don't have a sense of self because they weren't over here finding out what they liked and disliked, and that people really thought they were valuable and needed, and that didn't happen for them. So in turn, a lot of times talking to people, say, do you understand how you got to where you are? And they're like, well, I don't know, it's always been this way. You'll get those answers and say, and literally a lot of times I'll chart out and say, you were busy surviving right here. You missed this piece. That's not it. Good or bad, right or wrong, you missed that. We need to go back and pick that up. How are we going to build that back into your life now? Because a lot of these are all skills I got to have to be successful. So I need to go back and say, okay, what things did you miss? What I missed is going to be based on what trauma was going on at that time. If the first 5 years of life went great, but things started to happen at 6, I got somebody who's got itself, but can't get along with people, they're in trouble with school, but there's not that sense of they don't know what's going on and they're clueless. Kind of know. If you really sit down, you can get a sense of, oh yeah, I probably shouldn't have done that, or they have a sense of awareness because they've got a little bit. They've got that core. It's just all those social skills, all those learning skills, that emotional regulation, that got missed. But I have a core to myself, and you can sense that in it. You sit down and work with them, and because out of that, 10 work with maybe 8 of them or 10 of them, out of that 10, you might get a few that come around for you. Go, I never thought she could settle down because she was so wild and blah blah blah. And, oh man, she's really got this. They're responding. That core's there, and that's how you know that. If those go well, 3, 6, 7 goes well, and I all of a sudden abuse or this, mom divorces, we get into somebody in life, or I get Uncle Joe comes to visit and I get abused in that 7, 8, 9 period, I actually have I'm pretty good with friendships, and I'm pretty good to have a self, but I am rotten in relationships. And I'm either 2 things. If I get especially sexual abuse at that time, I either get more promiscuous, I'm out there acting out, I'm acting that out on the world, or the flip side of that, I'm real quiet and I cover it real well. I'm real reserved. You see that depression and anxiety piece when they're withdrawn, because I'm not going to let anybody see this. But again, I've got skills, so I can hide it pretty good. I'm not out of control, so I can hide this. You might not ever know it. And those are the people a lot of times when you meet in their 30s and 40s, and they come out and say I was abused, and people in their family are like, you were? We didn't see that. You never acted. You never said anything. We never saw anything, because they were, again, they had some skill level there before that happened. Younger kids, they don't have the skill level to do that. That abuse starts to accumulate. They've got some skills to hide it, internalize it. That's not any healthier mental health-wise, but in turn, they can function and get away with it, and people don't always notice. And that's one thing when you sit down with people and you think, well, they've got some wherewithal. They do some pretty good. And then all of a sudden it comes out, well, actually, blah, 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 and you see a lot of things start to come out. And because they reach a point where I can't do that anymore. Most people, again, growing up, if things happen to them, if it hasn't come out, you're not going to see it until usually, again, middle to late 20s or early 30s. Because I am working so hard and so fast to get away from that. I want to forget it. I'm going to go on my life. I'll do my thing. That's never going to happen to me. I'm not going to go through the mistakes my folks made, blah, blah, blah. I do that, and all of a sudden I get out there and realize, I start to be with people. I start to have kids of my own and realize, it's still there. And that's what's probably gonna hit me in the face, and I have to turn around and start to deal with it. The other side of that is a lot of times that people don't get married, those are the individuals that withdraw a lot of times who don't get involved with people. They're the ones you start to see that come in their 20s or even in college, or they get out on their own, and they'll go in on their own and say, I need to talk to somebody about this. Because what they do is they're far enough away from it that, it's like if a tiger's chasing you, you don't stop and turn around. Wait till you think the tiger's gone, and you look, okay, it's safe. Now I can stop and think about it. Now I can start to talk about it. Now I can So I don't need that. So I don't see that unless it's court referral. I probably won't see that till then. Again, if those teen years go pretty well, just before puberty and stuff, I got in my teen years, and all this has gone well before, then I'm rotten in relationships. I'm the person that functions pretty well, but I don't know what I want to do in life. I'm going from job to job. I go from one kind of yo-ho to another in my dating relationships. I'm not good at relationships, and I'm not good at my career. Finding stable employment or being able to do those things, which in turn ends up, I'm not good at independent living. I never quite make that leap from being at home or quasi in a program, or I'm in and out of, maybe boys and girls home, or I've been out of the home a few times, or whatever it is. But I really struggle with that piece to be able to make that move on and be independent as well. That independent living just doesn't happen. It talks about choosing abusive relationships, early pregnancies, no family structure. Those are the people that have two other couples and an uncle and their grandmother all living together, but grandma's the only one that has an income. Those are the types of things you start to see. Again, they're all functioning. There's not significant illness there, but just no one works. No one gets up and makes sure the baby's okay. No one gets up and gets the 12-year-old to school. They just don't get, those things just don't happen. But they're functioning. They've got some pretty good skills. They just don't make it happen. And eventually, if we look at later on, and I'm not going to go into those specifically, is basically those are going to be situational. If I've got all those skills getting up to that point, and then I start to have abuse or things later on, I might have trouble in my life. In the 40s, I might have constantly changing things, or jobs or family, or resides with family. I might always have struggle with that, but I kind of function and get along. Extended family or child care and support. Those are the people we see multiple generational, a lot of times people helping each other out. How many grandparents and great-grandparents do we see raising grandkids now? Or parenting their child to do it. A lot of times it's great-grandparents. That's one of those things when somebody says, this is my grandma, and you realize, well, she's pretty old. She's in her 70s. Well, she's actually great-grandma. They've actually, mom and grandma aren't functioning, but great-grandma, you have to go back to her, because she's the one who's got the income, that's got the house, and got some security for the rest of them. And so you start to see that, again, that's that generational thing that starts to happen. I miss those things. And if I can, when I start into treatment, we talk about, I put on there safe places, safe people. No one's going to do any good work until they feel safe. I don't, none of us do. And so a lot of times our role in that is, how do we create a safe environment? I'm here to support you, not to report on you. I'm here to help you learn how to do this. Again, what things have we missed and what are we doing? This is a lady who needs a lot of help in learning, again, when I talk about learning recovery, helping them see, what did I miss? I was sexually abused at 7, so I really struggle with this. Okay, we've got to really work at building relationships, friendships. What do you like to do? There's a lot of work to be done there. Or is this somebody where things went pretty well and it was in high school that I started to have trouble? So this is somebody I might have to do some parenting and some other things with, but I don't need to have them in therapy and I don't see the significant anxiety or depression and other things that go with that they have to be on medication for. They're the ones that respond. If I get back in this area, then I'm probably going to look at more intensive therapy. A lot of times I put addiction on here, addiction treatment, because for a lot of those folks, the addiction issue is so high, you're not going to get anywhere until that gets resolved. Especially now, it seems like, and it's not just drinking and drugging, it's the combination thereof. Opiate addiction, there are people that have a lot of pain and medical issues, and you throw in all the other stuff with it. They really have some really strong addiction issues that are there. In young men, we're talking about moms here, but in young men, these are the video addicted guys. They're, these are the 20-somethings that they're still living in the basement. What do you do with your life? Nothing. They're on the video. They can't get them out there. They can't get them away from their games long enough or out of the basement long enough to go fill out a job application, go to a job. No one's there saying, get out. You have a place to sleep and eat, and I've got internet. What else do I need in life? I don't have any desire, interest, or anything else because it's gone from hobby and addiction, and that really has become an addiction issue. So those young men that you're dealing with, especially the late teens ones, who have no motivation, no direction, no nothing, that's going to take a lot of work because they're going to get through that addiction issue before you get past being able to change things. And a lot of times you don't have the resources, or you can't be there 24/7 to say, shut it off, go to bed, because you got to go to work at 5. No one's there to do that. Even if they are willing to go to work at 5, they don't have that. But the safe place, safe people. That means they have to find therapists they're comfortable with. They need family support workers they're comfortable with. They need to have people out of the home that are dangerous in being there, and good people that come over that are safe to come over. So a lot of times that's structural stuff, even at school. Are they safe at school? A lot of these kids aren't safe at school because they say, oh, they get bullied. We're past being bullied. We're past being bullied. I'm not going to go to a job every day where people yell at me, call me names, trip me, take my stuff. I wouldn't go to a job like that. Why do I expect a 13-year-old to face that? I think there's some really hardcore, we've got to be able to step in there because I know schools are overwhelmed, teachers are overwhelmed. How do I do that? How do I do that for, a class of 20 if 10 of them are in that position? And we're going to see more of that. How do we structure things in our learning environment that's going to make it safer for kids? And most of them love resources. They either hate it because they get taken out of the room, they like the social stuff. But those are the better functioning kids. The ones that are really hurting like it. It's one-on-one, it's away from the rest of the group. I don't have to deal with all the anxieties and negotiating that social environment. So, I think that's, when we talk about safe place, we need to look at creating that first, because no one's going to do well. I always think that's hard because if you get referred by the courts, obviously you're always not on a safe place right then because there's that fear of what they're going to find out, what they're going to do. But in turn, it's like, okay, we're dictating the time when you need to get help, and we're dictating the people that are going to be in your life to get help with, and they might not be the people that need to be there. And so we have to really take a look at what makes them safe. Who are the safe people in their life? Especially with kids a lot of times, who are they safe with? And you can usually tell, who are the teachers they gravitate to? Who's the family members they sneak out to go see? Who's the, and not go have fun with, but who, when they really need something, who do they go see? Who's their go-to people? That's going to give you a good indication of who's safe here. And if I have parents that are that way, again, I'm talking about adults who got abused and now they're having kids, so they're needing to be parent. I put that on down here about in support services, but I teach Bonnie all the time about she's got to raise them first, being the parents. She's got to raise them to raise the kids. And I don't mean that I don't mean that to be hurtful, judgmental, but in a real way it is they missed all that piece. No one parented them. And not in a, you need to learn how to be a parent. No one said, I love you, I care about you, you can do this, here's how you do it, this is what we can do for you. Nobody was there doing that. No one said, you're good at this. Yeah, you struggle with this, but you're good at this. You can handle this. I believe in you, you can do this. They didn't get that piece. No one did that piece for them. So in turn, when we come in and say, you need to be going to family therapy and individual therapy, and you need to get the kid to this, and you need to get the kid to this, and they're like, all thing they're doing, they're just running around with chicken and head cut off because they still don't get it. You're just saying, I'm not good and I've got to go to these people because I can't handle it. No, that's not the case. We're doing this. How do we succinct this in a better way? That's one of the things I put on here about mental health therapy. I put therapeutic relationships. I don't care what, I listed a few, but we can list a ton of different therapies you can go to, of individual therapies. The basic thing that I need out of that, when you look at developmental, I need a therapeutic relationship. I need that trusting relationship where somebody can start to say, you're okay. Accept you where you're at. We're going to work at this. It's not your fault you missed a lot of this stuff. You're responsible to change it now, but it wasn't your fault getting here, so too bad, so sad. It's not an excuse not to function. We got to move on, but you do now. I know I'm here to help. I can do this for you. I can do this help with you. Who's your family support worker? Who's your this? Who's that? You know, they need a good attorney. They need, you know, here's your attorney helping you with this case on the custody or on this or on the divorce or whatever it is that's needed to provide a safe place, safe people for that family or for that individual. So the mental health piece is a good relationship. You know, then once that relationship there, then you can start to work on the skill stuff. More often than not, you're going to look at more intensive, what we call trauma reaction experiences. You're going to look at EMDR or some of the more intensive therapies to deal with the trauma. If you have people who are borderline, if you have bipolar, if you have a lot of other things there, you're going to look at a lot of medication and maybe some inpatient treatment as well. But again, what does it take to get that family safe, that person safe, you know, so they can have that structure in their life and be able to work on their stuff. And some, you know, it's like we talked about, there's some kids who need a higher level of care. They cannot do that work where they're at. What they need in their life can't happen in that home environment. And a lot of times that home environment can't do what they need to do until the stress of working with that child's out of there. You know, they're still, you know, we can go ahead and say you need to do this, this, and this, but they're dealing with it 24/7. You know, they need the break sometimes to go, okay, this is what you can do, this do, and have a chance to set things up and get a little bit of better handle on it before you reintroduce that child back into the home. So it goes both ways. A lot of times we're looking at the child needs that, and we always look at, well, they just want to mail the home. Well, perfectly honest, if I dealt with them 24/7 as much as they were, I need a break too. That's the concept of respite care is, I really do need respite. I need some time to go, oh, I'm not on 24/7 duty. I can have some time to think about this. How can I change the house? What can I do for me? How can I do that before I'm back into that parent role? So how do I go about that? And then I put the support services, parenting, life management skills, respite care, vocational family support. All those things can happen after some of those basic things have been gained. I've got to make sure this piece has been brought forward before I can do a lot of that. If they don't have that skill, they don't have that belief in self, they don't have some of that real work done, you're not going to get there. And that's what we see. You know, you've got somebody, especially generational, you've got grandma that didn't function, you know, children, you know, adult children and parents who struggled all their life because they were in that situation, and now you've got a teenager into that situation. You know, none of them are at that level of a skill level. Is how do we, you know, where do we go for the child to get stuff? Where do we go for the mom? What do we need to do for grandma? You know, how do we get those things in place, start to stabilize this to make it a safe place, so we can start to do some work with it. So that's the marathon. Throw this all in, and hopefully give you enough time to ask questions. I hope it gives you a vision of that, because when you come into a family and go, okay, what's going on here? I knew there was Bonnie and the workers a lot of times. They'll start talking about saying, Mike, back up. Now, what was that you just said about, you know, Uncle Joe was there when the blah, blah, blah? I was like, okay, let's check this out. I want to hear more about this. Because that's a red flag to me that there's a lot more going on than this kid wanting to skip school or refusing to do work or, you know, refuses to handle things with mom. What's the deal here? What am I looking at? Is this a family that's functioned fairly well and now they're struggling and we can step in with support services and probably do a pretty good job at stabilizing and they can go on? Or is this, no, this is, you know, this is a mom or a grandma or a grandson who really has some significant issues that they need to address before we can go on with this. Where's this child at? What have they already gone through? You know, some kids, you know, people say, well, they need to be in counseling. Some kids really don't need it. You know, one-on-one's not going to do it. They, you know, if they get into a state, they've got skills. You know, if you sit down, they've got the skills they need. They don't use them. And there's no structure in the home for them to have a way to use them, or at school. No one's monitoring or supervising for them to use those skills correctly or appropriately. But it's not because they don't have skills. And if they're resistant to that, sometimes if you hook them into this, you know, it's kind of nice if some kids even sit down and say, well, what's going on in your family? Well, I know mom went through this, you know, and they'll start talking about the other people in the family, but not see themselves. And then pretty soon they'll say, you know, I never have really liked people that close to me. Or, you know, I'm sure people are going to say I pick bad friends. Well, why would you say that? Well, you know, and they start to have a little insight into that. It was like, why do you choose those people? Well, because they don't make any demands on me. Anything goes. You know, It's kind of nice to be in a place where anything goes for a while, but then you have nothing but anything goes. You never get anywhere, never go anywhere, and people steal from you, and they leave you stranded, and then all those other things start to happen to you. Questions, comments? Now I'm going to turn it over to from anywhere. What do you see most in your face? What do you think you need the most help? I know it's early. It's not that. It's early my time. I'm on mountain time. Do you feel overwhelmed when you walk into them? A lot of families? Like, where in the world are we going to start with these? What are we going to do? Okay.
I think families refusing services maybe is kind of the hardest thing for me. Like, we offer this, and they don't, no, I don't want to do that. I don't. It's just so frustrating to me. Like, there's all these things you can do to help yourself, but you're not doing it. So it's kind of that.
So why would you refuse help? Well, if you needed help and you refused it, what would be some of the reasons you would refuse help?
Trust anyone, I guess.
Yeah, what are you going to do? You're not going to get my business and then you're going to take my kids. Or you're going to report me to police because I got something in the house. Or more importantly, you're going to judge me. You're going to see me for who I am and think I'm worthless. I already know that. Told that a long time ago.
Or I think sometimes they don't think that they have, it's not an issue. It's such a normalcy in their lives that they don't think like this is a problem.
Yeah, this is a lifestyle that we've lived
If
for
my
generations.
parents were like
Yeah.
this, you know, it's been like that for
True.
so long
You know,
that they're like, why do I need help? There's nothing, this is.
I had to go through it, they can go through it, what's the problem? You know, okay. There's some, I think, it's fear. It's that fear that you're gonna, one, remove my children, find me guilty of something that you're gonna incarcerate me. But more importantly, I'm gonna be made to feel as little and worthless as I did when I was little. That I didn't count, I can't do anything right, and it's my fault.
So how do we encourage, like from the school perspective and stuff, how do we encourage those people to work with these outside groups, you know, those support groups? Does that make sense?
Because part of that is somebody within that group to reach out to that person individually, to see past the ringer, the garbage, a little bit there, and that, you know, pose to fight you on every level. And a lot of times it's just saying, you know, we've noticed a few things at school, and we're just wondering if you noticed anything at home. How do you feel things are going? I'm going to give a lot of power to them, because more often than not, we don't have a lot of time. So we bring them in, they this at school, we think they should be having an evaluation, and, you know, we tell them what we think, we see, and they should do. Again, you're too stupid to know this, so I'm going to tell you what you need to do. Rather than sitting down and saying, what have you seen, you know, we just ask some concerns about your daughter, you know, about Jasmine. You know, what do you think? You know, I guess, how do you feel? Well, I don't have a problem with her. Well, we've noticed a few things at school, we're just wondering if, you know, if there's some things we do to help. Well, you know, and you start there on that real basic level of, I believe you know what you're doing. You're her mom, you know her best, and in all honesty, that's true. No matter how dysfunctional I am, I usually know my child. I might not do the right things by my child, but I know my child. The other part of that is, I don't know of any child I've ever been around, even the ones who was successful adoption, who don't say, I wish I could have had my real parents and had them function. You know, there's still that, there's a thing there. I still love them. I might not trust them, I don't want to live with them or whatever, but I still love them. I still have a care about them. And so I think a lot of times when we see it, we think like, how could they want to be in that situation? And a lot of times they don't. And you'll hear kids say, more severe kids. But more often they don't want mom and dad to be gone, they just want mom and dad to be different, or life to be different. And a lot of times if you start at that point, even with families, well, we're just concerns about things. If we can do anything to help change, you know, Jasmine's experiences right now at school, what do you think they should be? What would you recommend? And try to hook them in early on of, what do you see? But it's not just what they see, is you're saying, I trust you as a parent in this situation to have some good insight on this. And more often than not, if you really can touch that heart, what you're going to get is, well, I'm probably not the one who should tell you, I'm not the best parent. You know, I get rid of that, and they'll start to own up. They'll start to open a little bit and say, hey, we are all that way, you know. That's not our purpose here, here's to help. So what can we do to help? Now, no one's here to judge. We judge all, if you do that, we're all in trouble. So what do we do to help? I really want to push that trust piece that, hey, I'm here. I want to reenact this a little bit. That's why, like, when you meet with your kids, you always smile at them, you always have a treat, give them a hug, you know, look at them a lot, give your eye contact. You're trying to do that. You're trying to build that with them, and you're trying to do that with that parent. You know, parent-teacher conference. Would you like some coffee? Would you know, have your treat, you know, have donuts there. You know, have something to eat, talk about it, and again, give that eye contact and that, hey, I'm so glad you came in. I want to do all that piece. And then say, okay, you know, this is what we're here for. And again, that's hard to do in our society today or in our business because you've got 15 minutes, you've got a class in 10, you've got another client in 15, I've got 4 more homes to visit today, is that we really struggle with that ability to be in the now. And that's one thing that our kids do, no matter how dysfunctional, they live in the moment. They really do live in the moment. And a lot of times we see it as impulsive and not planning, but a lot of that means if I live in the moment with them, I can be on that basis with them. I can join them there. I can't do the past and future stuff, but I can join them right now. I need to be able to be there with them, full attention. And I would say most of the time, even as professionals, we have a hard time letting go, being with people for real, right there in front of you. That's a hard thing to do. Because you have a lot of other responsibilities, a lot of things going. And it is hard to put that, you know, what are you doing, mister, or what are you doing, lady? Look at your situation. Especially, like, say, with ones who said they don't need services, you're like, you know, your child's kicked out of school, they're pregnant, and they're blah, blah, you know, what do you mean? You know, but still, come back to that. Got to be there with them.
Well, and I see just like some that I work with, especially like being in IEP meetings and stuff with them, you know, you go back to the, you know, not telling them how, you know, loved they are and everything, or kind of treating them bad, and then they're like 12 or so, you know, they're going into middle school and they're in IEP meeting, they hear that from the school, and then you see the parent kind of, you know, looking down because maybe that happened when they were little too, and the trauma, it's a cycle that, you know, like you said, the circle that keeps going around. You kind of notice that maybe saying, you know, but here are the positive parts that the child can do, like you said, the skills, they're there, they can do them, they just have to have a structure and then know how, you know, like, to be taught that part, but I see that a lot.
Yeah, we always talk about being strength-based and looking for strengths, but we struggle with that, because, boy, you get into a meeting, where do you go? Whoop, left turn. We're going down. Well, you know what they did yesterday. Or you know what they pulled in. It's hard to stay on that strength and really, and not just give it lip service, but really focus on that strength level. You brought up something that I appreciated, I kind of missed here, was the thing too, is a lot of times, if parents, you know, if you've got young parents, and they have some pretty good skills, but they get pregnant early for whatever reason, so they end up having early families, and they're struggling a little bit, or maybe they get into addiction issues, but especially addiction issues. And so the first, 4 or 5 years of that child's life, they've been in out treatment, they've really struggled, they've been in jail, they come out and they've got their act together, and by that time, the child's 7, 8, 9, 10, 11 years old, and they're like, you know, I don't care, you know, because they missed this. That child, even though that parent's doing a lot better now, they're in a lot better situation, and they want so badly to make it work, and you see that, because that child needs a lot of work to get to there, because they're not there. They're going to have to rebuild that relationship. And a lot of times with parents is being able to help them see that, say, you know, good or bad, right or wrong, you weren't there right then. So we've got to go back and work on this piece with you and your child. It's not because you're a rotten, awful, terrible person or anything else. It's just pure logistics. You weren't around. We need to do this. That's one of the things when we talk about dependent personality disorders, a lot of personality disorders. You know, if you look at how depressed a lot of women and men, but especially women, are right after childbirth, and those first few years, especially if they struggle, you've got those early years, And probably say, well, they were always home, they were at home, Mom, what's the deal? But they were so depressed, they couldn't attend to kids. You know, that emotional, hey, honey, this is great, let's go color, you're great. That didn't happen even though they were home. They were so depressed trying to just get themselves up for the day. They were there but not there. And we talk about that, about learned dependency, that learned or modeling. You know, I put down here modeling. Modeling is our strongest teacher that any of us use. If I model stuff in session. You know, I don't like the F word a lot. and you get a lot of clients who that's their main adjective in their vocabulary. And if you say, don't use that word, what happens? You know, they shut down, they won't talk to you. So if I come in the room and I never use that language, and over time, they say, well, I know, you know, I bet you don't like that. I say, well, I prefer not to. And you'll see about 6, 7, 8 sessions in, I don't hear it anymore. I don't have to get in their face to get it stopped. Same way with kids. I don't have to get in their face to get it stopped. I can model that. And yeah, I have to endure it while I'm modeling it and waiting for it to change. But it works a lot better than trying to get in somebody's face. And you know, I just use that as an example, but I mean, there's all kinds of things like that. We can model that. Other questions? I know we're getting short on time. Yes?
Do you know about postpartum depression? Is that the same as just having the depression after the baby, or postpartum depression a major?
Postpartum depression is still it's a biological. You know, it's that hormonal estrogen that comes after childbirth. And for just like, well, plug your ears, Joe. For most women, you know, our gynecological history is based on our families. I mean, some have had periods where you were sick in bed for 3 days a month, and some were like, it was no big deal. You didn't choose that. That's your mom, that's your genetic history through your mom. And that's same true with postpartum depression. You know, how big a fluctuation of that level, how much stress I was under, what my health was, goes into that. But a lot of that's genetic. I'm going to look at mom's history. The women in your family had depression after childbirth. And most of the time that's going to be right on, because that's part of that genetic piece. And it's biological. I mean, they need a lot of emotional support. I don't want to take away from the talk therapy piece of just, hey, this is what's going on with you, it's okay, blah, blah, blah. It's just your body's doing that. You're not thinking those things. You're not that way. That's your body. And that's what's going on in your brain with your neurotransmitter balance, this, you know, hit the bottom with the hormone changes. And once most people do that, but again, a lot of times I'm going to look, is this a woman that, you know, in our family, postpartum months and they were fine, or is this people who, it took about a year or two for them to really come back around. Most women's bodies don't go back to being the normal functioning for about 2 years after childbirth. That's why most people don't want you to have a child every year. And even though, yeah, you're back doing things right away, but actually your body to really get back to normal, like, hey, I'm ready to go again, takes a couple years. Some families, they can bounce back and do real well. Some, you know, they need 2 or 3 or 4 years in between for their body and for themselves to get to a point where, hey, I can take this on. But the postpartum part is, it's usually go to your medical doctor right away, or your liver doctor. Because I don't know of any of them today who aren't really pretty quick to jump on that and recognize that. What you say?
The baby then?
Well, yeah, if they're not getting up and taking care of them. Again, they're crying, so you let them cry for an extra 30 minutes. Or you skip a bee feeding, or you know, you do a lot of things because you don't have the energy to get up and go do it. And you don't coddle and you're hold and tube so that you're so exhausted you can't even handle onto the baby. That's the other part that I think is the enjoyment. If I get feeling really bad about myself because I'm not doing that, then that starts that negative cycle of I'm not a good person, I'm not a good parent, especially if I had this in the background. You know, what's wrong with me? You know, I'm screwing this up just like I do everything else. And, you know, get all those self-defeating talk goes inside. So, other questions? Is this what you wanted?
It's perfect.
Anything else?
I was just going to say,
Oh,
Lee, do you have
you
time
too.
to stick around
Yes.
if they have questions? So you're welcome to stick around and ask if you have specific questions for Shona on some families that you're working with and everything. It is time, so I know, especially the supervisors, they probably are wanting everybody there back at work when they're supposed to be, but Shona is available. Ashley right there, she has some brochures for our wraparound program and referral forms. And I'm kind of looking around I'm thinking most people are probably familiar with what that program is, but we can provide wraparound services for a child with a severe mental health diagnosis. If you have a child that you're working with that has behaviors, you don't need to know if they have a diagnosis. We can determine that, meeting with the family. And what we will do is, our goal is to keep the family in the home, is to try to find as many resources as we can to wrap around the family. So there's brochures, there's referral forms, and again, most of you are probably familiar with it. If you have any questions, there's phone numbers on there. Any questions in regards to that? We serve the whole 17 county area, the Region 2 area. We have offices in McCook, Ogallala, Lexington, and Warren Platte for our wraparound program. With that, I think if you have just specific questions for Shona, you can ask as a group, or you can just come up to her if you want, and make sure that you signed in on the sign-in sheet so they can get your certificates to you. And trying to think, the July, we had a poverty simulation scheduled for July. And if you registered for that, we are having to change the date for that. So we will get a hold of you. I think it's going to end up just being more date. So more information on.
I'll throw out some things. I mean, if you need to go. One of the things I was thinking about too is that working with some of our, a lot of times then kids get up to about that 16, 17, 18 years. They've been in and out of services a lot. And the safe place, safe. I know the people, they know that I'll say, we just need to get them out of that house. We don't take them out of the house, but we just need to help them. There's no reason to try to go back and do all this work with the family, because they're not working, and at the age they are, with all the interventions they've had, it's not going to happen in the next 2 years or year that you have in your service. So what's the best thing we can help them be prepared to be successful, independent? So there's a point there, a lot of times, especially with families, where they've heard me say, how about a job corps? Is anybody in the family they go work on the ranch? Is there, can we get them, so they're at that age where you can't go back real well, just for their ability. Family system. That's going to be up to themselves later on, but I want them to have the best chance at having the skills to be successful. And so sometimes that comes in there. I was just thinking about that, is that we're talking about going back and doing a lot of work, but a lot of times there's a point there when, kids need to be, that's not a safe, it's never going to be a safe enough place for them to be. One of the things I always tell kids is that a way of helping them with that, because most of them don't want to do that, is I always say, you love your parents dearly, or your mom dearly, or whatever, she's just not safe to live with. I mean, I'd like to say she's really good at showing how she loves you and takes good care of you, but we've talked about this a lot. You can love her dearly and not, and recognize that she's just not safe to live with. I know and they might not, well, I don't want that. I said, I know, but that's what's happening. People, it's just too unsafe for you to be there. When you're older, you get the choice how much you want to live around your mom. Right now, we have to make sure you're safe. And your mom loves you, but she's not safe to be around. And you're not safe in that environment. And a lot of times, they don't like it, but they see the reasoning in it. Because if you say, well, you can't live with your mom, she's da-da-da-da-da, then you're saying, I can't love her. Or the flip side of that is, you need to love your mom, and there's some kids who are like, I'm glad to be out of there. I love my mom, but I want to live with her. I don't want to live with them. I want to live with her and the boyfriend. I don't want to live. That's okay. You can love her dearly and not live there. You have a relationship with her the rest of your life. You can decide how much contact you want to have. Where's your safe place and safe future?
You help them look at the future. Sometimes they're so stuck in what's going on in their life right now, they don't really look at the future. Sometimes people have never even talked to them about what are you going to do when you are 18, 19, 20. If you help them see that they have a future, that helps too sometimes.
Yeah, and that's why I say they're great at living in the moment. And sometimes that's their advantage, but the other times is, especially like some, and they don't have any interest. I have any desire. I don't know. I don't care. And they have nothing to motivate them to move forward, and really trying to help them with that. They always used to send those kids to the service, but you can't do that anymore.
They can't get in.
Well, they can't get in because they want people that are functioning higher than that, so. And that's a good thing. Go ahead, go. I mean, I just was, I just thought I'd throw that
Yeah,
out.
again, you're welcome to go or stay or whatever.
Or ask questions or what.
Thank you.
You're welcome.
Thank you. I know.